I think it's safe to say that any effort to repeal and replace is gone. The House is certainly not going to pass anything that would repeal the Affordable Care Act. I think that there is room for common ground legislation to pass. I think that there's a lot of movement around what we've seen here locally in New Jersey on the national level with out-of-network bills and surprise billing. There's a lot of movement around that, and that's a nonpartisan issue. Everybody has constituents that go to the doctor. So there will be some movement there, but large-scale repeal and replace is dead. We will not see that at all in the next 2 years, in my opinion. I think it was 2007 was the first time I saw any sort of telemedicine. I was watching a show, it was on Extreme RVs, and Simon Cowell had a trailer for American Idol where he had a corporate teleconferencing set up directly to his doctor's office with a glove that had an EKG in it. They explained that, and this was 2007, I'm pretty sure it was. Now we're at a point where you can go online and for $100, you can buy a Bluetooth EKG. And that, or you can go buy an Apple Watch that's got high definition heart rate monitoring inside it. That technology, combined with the ease and the penetration of mobile phones, I think is going to make a huge difference on the chronic users in terms of managing care. Beyond, I've got kids, beyond the pink eye telemedicine calls, which are a godsend, the chronic care, I think, is going to benefit the most by the cheap access to technology. I think that the employer-based model is in severe jeopardy. Congress, every year, somebody will float a proposal to take away the employer exclusion so that every dollar that goes towards providing health benefits would be taxed as income. People that are proponents of that say that that would drive employers to continue to do exactly what they're doing at a higher cost than just fund the government. I think we would see the opposite happen. I think employers would curtail coverage pretty quickly, and people would be dumped into the market without their plans. But unless we get pricing under control, we will reach a point where employers will no longer be able to afford it. You can only take so many double-digit increases before it stops making sense as an employer to offer that as a part of your benefits component. And so I think we need to have drastic structural changes to protect it, and it's not going to be just the tax code. It's going to be what we were talking about earlier with provider pricing. It's got to be addressed, or it will be unsustainable.